Back now on Try It Today. So glad to get some of these good folks from Crossnor back in the show. It's been a while since we visited with them, and they do such great work and always have. On my right, my good friend, Holly Kessler is Senior Director of Community Relations at Crossnor Communities for Children, and she brought along a special guest. Kelly Riley is Director of Fostering, Home Licensing, and Training for Crossnor Communities for Children. Good to see you, ladies.
Good to be here.
Good to see you.
Holly, let me start with you, just for folks maybe who have just moved into the area or don't know. Very quickly, what's the mission of Crossnor?
So first I'll just mention that Crossnor School and Children's Home used to be our name the last time we were on the show, and we rebranded last summer to Crossnor Communities for Children. Our mission is to grow healthy futures for children and families by providing a Christian sanctuary of hope and healing. And so what that really means is that we work with children and family in need, mostly those that are involved with the Department of Social Services through foster care. We also have some family preservation services for families to try to keep their children at home, and then our outpatient therapy services as well.
Well, since you brought up foster care, let me turn to Kelly. Remind us what foster care is.
Foster care is primarily about keeping kids safe. So there is some reason that they cannot stay in their family of origin or their home of origin and be safe. So it's a temporary service where the kids can live in a screened and approved home while their family of origin works on the things they need to work on so that they can get back together and live safely.
Is there a specific need in foster care these days?
Absolutely. I would say foster families that can take sibling groups, that can take more than one child at a time, and also therapeutic foster parents. Now, therapeutic foster care is a special kind of foster care for kids that have a little bit higher level of need. They have a mental health diagnosis or a behavioral health diagnosis. And so for our therapeutic parents, they get more training, but they also get more support from the agency to meet those needs. But since January, we've received over 100 requests for therapeutic foster home placements, and
Wow.
about 98% of them we can't even consider just because we don't have the availability. So, yeah.
Yeah, well, Holly, you told me one time we were talking that individuals and groups can help when it comes to foster care. What did you mean that they can help?
Yes, so we have an initiative that we call Fostering Communities, and we're looking for individuals, civic groups, particularly churches, our church groups, that want to come around foster families and support them. Fostering is a hard job, and a lot of families that foster even have their own children, so they're adding even more kids to their home. And so to build a fostering community around those families and the children they serve is real important, and it could be anything, as a church comes around a family, maybe it's bringing meals periodically, maybe it's cutting the grass. We do know one instance is that we had a family down in our Hendersonville region who was accepting a sibling group of small children, and a church in their area came to them and said, "We know that you live on kind of a busy street. We're going to build a fence around your backyard so these kids can play
Isn't that
safely."
something?
So it's that kind of thing.
Kelly, before time gets away from us, is it a complicated process if I want to become a foster parent, and what kind of qualifications do I have to have?
Sure. It's fair to say that it is involved. There is, between the training and the paperwork and the home visits, there's a lot that goes into it to make sure families are well prepared and that we've done our work to make sure it's a safe place for kids. But the qualifications are relatively minimal. You need to be 21 years old, you need to have stable housing and income. There are some limitations to criminal history, and you need to maintain a drug-free environment. And other than that, it's about walking with staff through the process to do the training and the visits and all of that to make sure that fostering is a good fit.
And fostering is a good thing, and I just appreciate what y'all are doing with it. Up on screen, crossnor.org, still the same website. And for those of you that know about that, crossnor.org, please check that out to learn all about what is being offered. And Holly and Kelly, thanks for everything you're doing.
Thank you for having us.